Good day, global citizens. Welcome to another episode of Dr. Fajembola'S Opinion. On this episode, this is our inaugural, the first time we'll be discussing a book. I know my audience are used to scientific publications, but apart, we're trying to bring on Dr. Fajembola'S Opinion. Our books with regards to health of global citizens. So these are inaugural. It's the first time we're doing this, and I'm very, very sure you enjoyed this as much as I enjoyed interacting with the author. So, global citizens, do join me to welcome Paula Yost. I hope I pronounced your name right.
You did it great. Thank you.
Okay, what is the title? Miss, Mrs., Doctor, Professor. What is the title? Oh, you are just
Uh,
comfortable with Paula Yost.
I guess technically I'm Paula Yost Esquire. I am a lawyer and a licensed clinical mental health therapist. Everyone can just call me Paula.
Okay, Esquire, that's so beautiful. Actually, you are the second attorney lawyer I know is working in the field of health. I know lawyers, the world is so integrated, and you find doctors now in the field of law, lawyers in the field of health education. Like it's an integrated world, and I'm so happy to discuss with you on your book and listen and learn from the aspect of an attorney and a mental health professional. So let's give our audience an overview of Paula Yost's biography. Few professionals bridge the worlds of law and mental health with the depth and passion of Paula Yost. She's a seasoned attorney and licensed mental health clinician. Paula brings a multi-dimensional perspective that blends legal precision with human compassion. Paula has built a distinguished career in trademark law. Beyond her core legal work, she's deeply committed to what she calls legal social work, advocating for individuals at the intersection of law and mental health. As a mother of children with medical challenges and a survivor of life-threatening preeclampsia, Paula is on a mission to help families advocate for their children and themselves through storytelling, education, and unapologetic truth. Thank you so much for joining us on this
Thank
episode,
you.
Paula. Yes, it's so beautiful to discuss with a mother. I'm so happy I'm also a mother, so I think we have a lot of similarities, health, motherhood, and I'm so open to learn from you. Um, let's look at before we dive into the discussion, let's look at what global citizens are saying about your book and your book on pardon please a minute. Your book on how to be an advocate for your children and yourself in a failing system. That is something people need to learn because sometimes people are bullied, people are ignored when it comes to how to effectively take care of their children, especially those who are medically challenged in the system. So let's look at what global citizens are saying. The first is from Professor Ibrahim Abioye, who has been a guest researcher on this platform. He's saying previous guidelines suggest that pregnant women with sickle cell disease should be prescribed low dose aspirin to reduce the preeclampsia and intrauterine growth risk. Our new trial indicates this practice may be harmful. So this is a new publication from Professor Ibrahim et al. On preeclampsia and effect on aspirin, low dose aspirin on intrauterine growth restriction. So
So,
the second,
yeah, I have not the sickle cell, but with the human experience of the preeclampsia and the treatment with aspirin, at least in my individual case, that 100% worked. My second child was my preeclampsia baby, and
okay,
he was born at 27 weeks. He weighed 1 pound and 14 ounces. And in my third pregnancy, I was terrified. In full candor, my third pregnancy was unplanned. And I was absolutely terrified of winding up back in the hospital with preeclampsia again. And my gynecologist put me on aspirin. She didn't let me go on it immediately because she said it could
Okay.
interrupt implantation. But after
Okay.
about 6 weeks along, 6 to 7 weeks, I started taking it and I made it full term with my third child.
That's great. That's great to know. I'm glad to know you could relate with the tweets from Professor Abioye. Let's go to the second tweet from Jenny Wenner, where she's saying help a mom. She probably helped a mom advocate for a kid. The school failed to do resource minutes or progress monitor, even though the IEP called for it. If it's in the IEP, schools have to do it. The school agreed to make up the minutes, something like that, without knowing the law. The kid would have been given nothing. I guess she's talking about speaking up for a kid that needed IEP, and like the process is not effectively carried out. The last is from Amses, where he or she is saying, I don't think anyone would argue that correcting a cleft palate shouldn't fall under the umbrella of medically necessary. It's quite definitively not a cosmetic procedure. Some people are like cleft palate surgery is not really necessary. I don't think anyone who argues a cleft palate surgery is not necessary, then they don't know what a cleft palate is.
That's correct. That was my
Exactly.
experience.
Exactly.
That was my experience. So my oldest child, my first biological child, my son, he's my cleft palate baby, not to be confused with my preeclampsia baby. But my
Yeah.
first child, that the preeclampsia baby was baby two. But baby number one was my cleft palate baby. And I think that because people see on television the excellent work that Operation Smile and Smile Train are doing, those are two nonprofit organizations that do a lot of work in Africa and India in order to help correct craniofacially different children. I think that because of those advertisements, people think it's just one surgery, and it's not. One surgery is good with like helping to rebuild the upper lip and the parts of the nose that are not there, but it doesn't take into account other things that you may need. My 12-year-old has had 5 surgeries. He's had orthodontia since he was 3 years old. He's had speech therapy, significant, like daily speech therapy for years and years. And he's probably still going to have a considerable amount of surgery and also dental work. He has spaces in his mouth where he needs teeth, but teeth are never going to grow. And one of my biggest frustrations with mothering him was people not understanding what he needed, particularly with regard to speech therapy. Because if you have some form of speech impediment as a child, it impacts your literacy. So it impacts your ability
Exactly.
to read, to write, to spell.
Exactly.
And I didn't want my son to have unnecessary learning hindrances because he was not being able to get the speech therapy that he needed. So unfortunately, I had to go to war with other people in order to get my son the speech therapy that I knew he needed. And I shouldn't have had to do that, and neither should other mothers.
Exactly. Exactly. Thank you so much for elaborating on that, Paula. Um, now we already have an appetizer. You've started it beautifully, and what attracted me on the title of your book is The Failing System. You gave birth to all your children in the United States. Am I right?
Yes.
Now, I live in the United States, and anyone outside the United States, if they come across your book, they'll be like, failing system. We are like, the US is the number one country in the world, the peak of healthcare globally. What is she trying to say? So, what do you want someone outside the United States, maybe someone in India, someone in Pakistan, someone in Ghana, Nigeria, who comes across your book? Before reading it, what do you want them to understand about the failing system?
Well, I think one of the things I would like to say, first of all, to an international audience is that just because I live in the United States does not mean that our systems are perfect. They are far from it. It also does not mean that when it comes to early childhood education and welfare, that we are doing it correctly. I have a little bit of a travel addiction, and my personal opinion is that many of the Scandinavian nations are doing a much better job with their systems for children in general than we are in the United States. And some of the areas where I see significant failures, I think if I'm going to highlight some quick ones, there's two that I think are the most important. The first one is the importance of early childhood education and intervention. So, when I'm talking about that, I'm talking about our 0 to 5 population, our little guys. Um, with those guys, they are so smart at that age, and their brain is growing so rapidly, and it's like a little sponge. They learn everything at that phase. And we have a tendency in America to look at those children if they have something missing, right? If they need physical therapy, occupational therapy, speech therapy, if they don't have the hand strength that they need to color or to cut or to use markers, we have a tendency to say, oh, they'll grow out of it. There's nothing wrong with them.
Exactly.
And sometimes children do grow out of it. That is possible, but many times they don't. And I don't want to be in a situation where a child who has a problem that's correctable at 3, 4, 5 is now dealing with that problem at 7, 8, 9, and we're not correctly fixing it and dealing with it because we didn't want to do it earlier. So I guess what I'm saying is that Americans have a tendency to kick the can down the road some of the time because of finances or because of this belief that it's just they'll grow out of it. And that doesn't really work. And so I would like to see our nation do a better job of investing funds in early childhood and also early childhood education. So in many states, like Georgia is a good example. Georgia has an educational lottery that uses those funds to fund preschool educations for children for pre-kindergarten, so 4-year-olds. But in my state of North Carolina, we don't have any form of funding for that that's sanctioned by the state. We have some federal dollars for Smart Start, and you can pay to send your child to a church school. But most children don't really get preschool education unless their parents pay for it. And all parents cannot pay for it. So it automatically starts income inequality in our population based on whose parents have the ability to pay for them to do early childhood education and who can pay for early interventions and who cannot.
That's so beautiful, Paula. That's so beautiful. And it reinforces the foundation you've laid for the discussion. You have a legal background. And how does a legal background influence your parenting and advocacy as an individual?
Well, I think that my legal background has made advocacy easier for me because I went to law school in the early 2000s before I ever had my children. So I was good at school. I was kind of a nerd. And so I got some really solid professional training on how to be an advocate. So some of the things that I think stand in mother's way include people pleasing, wanting to be liked, and also just not being confrontational. A lot of women have been taught that you can't, be angry or make us stink or act like something is wrong. And so they tend to walk away from meetings about their children with schools or pediatricians or whatever, feeling unsatisfied and like they're not getting the result that they wanted or that they were looking for. But the emotion of that is a hindrance to them doing the advocacy that they need to do for their children. For me, my legal training broke all that down when I was in law school. I had to get very comfortable advocating, arguing respectfully. Like I'm not trying to incite violence or anything, but I had to be able to learn how to have discourse even when it was uncomfortable for me. And many mothers need to be able to have discourse even though it's uncomfortable for them because that is what their child requires and needs them to do.
Thank you so much for that, Paula. You are a mental health advocate, you are a lawyer, you are a mother. So, do you want, or how will you tell our audience to navigate the medical system when their pediatrician is not listening?
I think the easiest way to do it is to reiterate your points in a conversation first. So, if I felt like I was not getting what I needed from my pediatrician, I would slow the conversation down and say, please help me understand better. And I would say, I'm seeing my child do whatever it is you're seeing your child do. And these things are concerning me. And I'm worried that my child may have whatever it is you're worried about. And if the pediatrician says, I wouldn't worry about it, it's fine, based on the 20 minutes that they have with your child, then I would either seek out a second opinion or I would tell my pediatrician, can you please make a referral to some form of an expert? I would just feel better if I could go see an expert in this area and ask more questions.
Okay, that was quite elaborating, and eye-opening. You as an individual, you are a parent and you've been to IEP. What's one thing every parent should know before walking into an IEP meeting?
Never do that alone. So, in the United States, our public school children are able to go to these meetings called individualized educational plans. And so that's where, like, if your child has pretty much anything, I'm going to use dyslexia as an example. I do not have a child with dyslexia, but that is one of the more common learning disabilities that I see children needing an IEP with. So essentially, what happens is mom and dad or whoever are aware that the child is dyslexia because they're flipping numbers around in their mind and they're struggling with that very common learning disability. So, mom and dad walk into an IEP meeting, and it's mom and dad and 10 school system employees. So, mom and dad are very small portions of this conversation, and there's a whole room of other people. In my mind, when I was first going to IEP meetings for my son, I thought I was walking into an IEP meeting and this was a team, right? We were all here for one reason and one reason only, the best interests of these kids. What does this child
Exactly.
need? How can we do what we need for this child? What is in their best interest? And what I found that that was not at all what we were doing. Sometimes I'll be honest with you, I don't know what other people were doing. I was there for the best interest of my child, but I don't know what other people were there to do. I mean, I could probably spend 20 minutes ranting about the possibilities. But what I did know is that their goals and my goals were not the same. And my goals for my son did not match with their goals for my son. So, as a result of that, I Goodness, I like to see parents take an advocate with them. And I also want to add that an advocate and a lawyer in this capacity are not the same. Because if you bring a lawyer to an IEP meeting, the school system is going to shut you down and they're going to tell you, we can't meet with your lawyer without our lawyer here. And then they're going to try to like mesh schedules with both lawyers. And if they're not able to do that, then it's just going to become a thing. And so I usually like to see parents take an advocate with them. So, an advocate is a retired teacher who has experience writing IEPs and what they need, or it is a fellow parent who has a child with a special need who's been doing this for a very long time, who can attend that meeting with you and help support mom and dad. There are nonprofit organizations popping up all over the United States now with advocates who are willing to attend IEP meetings with parents to try to be on the team of let's get the kid what they need. And they're really lovely. And most of them are nonprofit organizations that are free. So I would strongly encourage parents to look and explore that.
Thank you so much for that, Paula. You opened my eyes to what an IEP is and that sometimes what they want to get is different from what you as a parent want for your child. And actually, the only sole goal should be the best interest of the child. So, Paula, you said you had preeclampsia. And one thing with you being a guest is we get different aspects of you.
Right.
Um, Now, how do you describe what happened during your experience with preeclampsia and how it's changed you as an individual?
Well, first of all, I think the biggest way that it changed me as an individual is it made me thankful to be alive. Literally, I am thankful that I am alive and I am thankful that my baby is alive. And I credit the reason that we are both alive actually to my husband. I
Paula,
am very
your
fortunate
network,
in,
your video is, guess, is the network.
oh, am I better? Did it freeze on us?
Yeah, it
I'm here.
froze. Okay, you
Oh
can,
no. Hold on. Of course, now my phone is ringing this second. All right. Let's try that again so I look better now.
you can just answer the
I,
question, start answering again. You can start answering again.
okay. Okay. So, the way that preeclampsia changed me is that it made me very thankful to be alive, and it made me very thankful my baby was alive. And I credit our lives with my husband, actually. My husband is a medical professional. He is a registered anesthesia nurse. And so what happened with me was I was about 26 weeks pregnant and I knew I wasn't feeling well. Like I was swelling a lot, but I didn't know what preeclampsia was. I'd never heard of it before. I mean, I knew that like in your fourth, when you get to the end of a pregnancy, people start talking about it and you have to pee in a cup a little bit more. But I had no idea really what preeclampsia was. And so I started swelling pretty significantly in my feet, but I just brushed that off. I was like, I'm pregnant. Pregnant women swell. Like, whatever. It's not that big of a deal. My son had also, my oldest son, who at this point was 2 years old, he had had a stomach virus. So I also thought that I was just sick. Like, I thought I just had caught something from my child. And I kind of brushed it off. But then one night, I was putting my 2 year old in bed. And I felt like somebody was squeezing the base of my brain. Like it was almost like a fist was squeezing my brain. And I kid you not, I felt electrical current like rolling through my head. I've never felt pain like that in my head at all, ever in my life. And I went blind for a few minutes, like I couldn't see. And I took a big deep breath and I walked out into the hallway. And my husband was like, "Whoa, what's up with you?" And I told him, I feel like my head is on fire and I can't see. And so my husband immediately took me to the hospital. And while I was in the hospital, like we didn't take an ambulance or anything, he just drove me there. And he didn't tell me what he thought was wrong with me. He didn't say anything. He just said, "I want to get you checked out." And so I calmed down. I felt fine. Preeclampsia is a silent killer because women don't know that they have it. And because you might have something like that horrible symptom that I experienced, but in the car on the way to the hospital, I feel good. Like I don't feel like there's anything wrong with me again because it comes and goes because your blood pressure is fluctuating. So I wind up back in the hospital and my blood pressure was like stroke level dangerous. Like it was really, really high. And my husband was like, "That's not good." And then they checked my urine, and apparently I had the highest concentration of protein that the test would register. So the next thing I knew, I was admitted to the hospital. People were putting me on a magnesium sulfate drip. That honestly, that is the most horrible thing I've ever physically done. That was worse than giving birth. The mag drip is awful. It makes you feel awful. Like I literally felt like I was dying. But they gave that to me to control my blood pressure. And they did get my blood pressure somewhat under control, but it only lasted for like 2 or 3 days. And then my blood pressure, I was in the hospital though, and then my blood pressure shot back up. And so Pearson was born at 27 weeks because essentially the interventions to control my blood pressure just simply did not work. And so as a result, I delivered Pearson. He was in the NICU for 90 days. He came home on a heart monitor. Like it was a lot. It was psychologically a lot. But
So
I mean, now he's fabulous. I mean, he's 10 years old. He, he does taekwondo. He reads on a 10th grade level. Like he is a
super
smart,
cute.
yeah, it's amazing. I mean, it is amazing what these little humans are able to do. Like, I had no idea that a 1 pound, I mean, he was the size of an American gray squirrel. Like, I didn't think something that size could live. Like, there are beanie babies that were bigger than my child. I had no idea he could survive. And so I'm just thankful every day for the fact that both of us lived and for the fact that I'm married to a nurse. Because I think if I hadn't been married to Peter and if he hadn't recognized what was happening,
Overlooked it.
yeah, I think what happened is I would have gone to bed and gone to sleep and I would have had a stroke because my preeclampsia would have
Exactly.
become eclampsia and I think I would have
Exactly.
died in my sleep. And there are better women than me that have been lost from this world because of that. Preeclampsia is the
Exactly.
number one killer of pregnant women. It's very dangerous.
Thank you so much for that, Paula. Thank you so much for sharing your beautiful story with us. And thank you so much. And storytelling, one thing with storytelling is people don't know the connection it gives and the impact it makes. You wrote a book, and I believe everyone listening to this, and everyone who wants to read your book, and everyone who will read your book will have an idea of, if they've not gone through what you went through, they have an idea of how to help other people who have been in that scenario, who have been in that condition. So, how do you see storytelling building, helping people connect and create impact?
So I think that it goes to the fact that we never know what someone else has gone through. We have no idea what other people's human experience is. And the only way we find that out is by talking about it to one another, and writing about it and reading about it. So I think that storytelling is really important because that's how we make people feel like they're not alone. We make them feel empowered. We make them feel like, well, what happened to me happened to this other lady. It's not truly my fault. Like, for instance, I carried a lot of guilt about the fact that my first baby had cleft palate and then my second baby was preeclampsia. I felt like that was my fault. Like, what did I do wrong? And one of the best things that ever happened to me was when I was laying in the hospital with preeclampsia. I'm sitting up in there, I'm on a mag drip, I'm super sick. I felt awful. This NICU doctor, the neonatologist doctor, came in and sat with me and he was like, "Do you have any questions?" And I remember saying to him, "Is this my fault? What did I do to cause this?" And he said, "You didn't do anything to cause this. Like preeclampsia happens to 22-year-old marathon runners. Like any mother can get preeclampsia. It's
Exactly.
it's a mystery of modern medicine. We don't know why it happens." And that gave me so much peace and so much freedom. And I just know that there's some mother somewhere out there in the world who's also carrying that form of irrational guilt. And so I think
Exactly.
storytelling is important because it helps us feel like, again, global citizens. Like these things happen all across the world and it's not your fault.
Exactly. Thank you so much. Especially for mother that is that's mother's guilt. Anything that happens to the child, oh, is it me? Is it what I ate? Is it my lifestyle? Is it a drug I used? So thank you so much. That's one of the effects of storytelling. Create awareness, educate, and allow other mothers know they are not alone in this. Or if you have a condition, this is normal or this is abnormal. So thank you so much for that. You mentioned your child with cleft palate. What do you expect? What do you wish you knew before giving birth to your child with cleft palate?
Oh, goodness. Well, a couple of things. One of the things is that you cannot feed a cleft palate child the way that you can feed a craniofacially typical child. And so, what I mean by that is your child is probably not going to be able to breastfeed because they're not going to be able to latch. But they're also probably not going to be able to use a typical bottle because they're not going to be able to get the suction that they need around that
Exactly.
bottle.
Exactly.
So, when I was pregnant, again, this goes back to I was fortunate because I was married to a medical professional. My husband has probably done anesthesia on almost every possible um, person. He's done every surgery you can think of. And so when we found out that my son had cleft palate, my husband automatically knew what we needed to do about that. He was really, really good at being able to say, okay, we need to take care of this issue. And as a result of that, he got me in touch with a craniofacial plastic surgeon who knew how to help me. And the two of us were informed about the fact that like eating would be a concern. And neither my husband nor our doctor wanted to do anesthesia on my son when he was little because the anesthesia before 6 months of age increases your risk of learning disabilities. So we ordered bottles from Japan. There are these bottles called the Haberman bottle and the pigeon bottle, and the Haberman looks like a long straw. It's like feeding a baby bird. Like you literally drop the milk into your child's mouth. And it took forever. Like during those first 4 months of Prattley's life, I was pumping milk, putting the milk into the Haberman bottle, and then feeding him. So feeding Prattley was like a 2 hour extravaganza. It was like I spent 1 hour pumping milk, 1 hour feeding him the milk, and then 1 hour resting. It literally feeding this child was a full-time job, but I did it and he ate and he was strong and he didn't have to have surgeries until he was over 6 months old because we didn't have to worry about being able to feed him. We were able to feed him, we were able to get him to eat. And so I think that's probably the number one thing. Like, figure out how to get your baby to eat because it's not going to work the way that it does for other children. It's not going to be effective. And if you rely on the hospital, so I don't know the statistical percentage of cleft palate in other countries, but in the United States, we have a cleft palate baby in one in every 700 live births. So the community where I live has about 2,800 babies born a year. So you think of all the babies that are born in the hospital, they have four per year
Exactly.
that have cleft palate. So you can't expect the nurses or even the pediatricians that are on call to know how to handle this. You have got to become the expert for your child yourself. And I think that was the best thing that we did was thankfully Prattley was my first child. I didn't have other children to take care of. Also, I will add, I wanted that baby. Like I wanted that baby so much. Prattley was absolutely a planned pregnancy. I wanted him more than anything. And so I had nothing to do. Well, I did, but I had nothing to do with my spare time during my pregnancy than learn how to take care of him. And it did. I was very anxious. I was very scared, but I made myself do it. And I think that my child had a better outcome because I did.
Thank you so much for that, Paula. It's great hearing how you prepared for your pregnancy and how you took care of your child when he was born, when he or she was born. So we want to know what can you shed more light on trauma informed education? What is trauma informed education?
So, this is something we talk about in America a lot. And trauma informed is being aware of how you need to treat a person who has endured some significant trauma. And trauma can come in all forms. We were just talking about birth. So I think one of the things that I would talk about with birth is, in my circumstance, when I had Pearson at 27 weeks, I was not prepared to give birth at all. I didn't even know you could give birth at 27 weeks and your child would survive. I had no idea. So I wind up with dangerously high blood pressure. I'm extremely sick. I'm not totally with it. I wind up in an emergency delivery with fluorescent lights. There are a lot of people in that room. a lot of women get the dignity of being able to give birth the way that they want to give birth, right? Like in your house or in a hospital with a few people there. There were like 50 people in labor and delivery. When there were medical like experts waiting for the baby, there were baby nurses, there were my nurses. There were literally like 50 people in this delivery room. It was a lot. And I'm a very I like to be a modest person, like, and here I am, my body is all on display in front of all these strangers who I've never met. My baby comes out. I do hear my baby cry a little bit. I hear something that I'm told is my baby crying, but then my baby is rushed away to a NICU. I don't get to hold my baby. I don't get to see my baby. I don't know if my baby is really okay, other than that the doctors are saying he's okay, but we've got to rush him to the NICU. And I don't get to see my baby for like 8 hours after this because I have to be healing up from my C-section. I've got compression hose on. And then, 6 days later, I'm getting discharged from the hospital with no baby. My baby's in the NICU, and I had to leave him there and go live at my house. That is a lot. And so being cognizant of when I come into the hospital for my third pregnancy, which again, my third pregnancy was an accident. I didn't know I could get pregnant. I come in, I'm terrified because I don't want to die. And I don't want to go through what I just went through with the preeclampsia again. And I'm really freaked out with that third pregnancy when we're getting into 27, 28 weeks because, again, I don't want to die. And it's like I relive all of that trauma again. So, mothers who endure things like that, or women who have a repeated history of miscarriage or failed IVF, that is medical trauma. And they need a little bit more love and care and assistance, not because of the medical aspect of what they may be going through, but the emotional care. We really do have to provide women like that some good bedside love. And if doctor doesn't have the time to do it, then we need somebody in that hospital who is knowledgeable, like a social worker or a nurse, who can really help mom get through that. And I think one of the most helpful things that anyone said to me during that horrible, horrible experience was, your baby is going to be fine. He's just going to have to grow in a box instead of in your womb. But that's not your fault. It's not a failure on you that caused that.
Exactly, Paula. We are discussing part of what we are discussing as special needs, who needed the IEP. So, what are the needs of special needs parents? What are the wants or needs, the issues special needs parents are addressing that you feel are rarely addressed or are rarely catered for?
I think a lot of it is education because, again, special needs parents sometimes tend to know there's an issue before anybody else, but they don't know what the issue is. They don't know how to find out, or when they do find out, they struggle to be given correct information. Everyone kind of wants to look at Dr. Google or Chat GPT, and that is not where you should be going to get your medical information. Um, I
Exactly.
re I really love a good peer-reviewed medical journal. When I back to when I was pregnant with my first, and I was trying to learn everything I could learn about cleft palate. I am incredibly knowledgeable about cleft palate at this point in my life, and the reason is because during my pregnancy, I read every medical journal that I could get my hands on that addressed that issue. And I just think that is so critically important that we are addressing those issues with our children, with parents, so that they do have proper education. So many people don't know what a medical journal is. They don't know how to access them. So I think that's important. I also think it's important that we're able to utilize our communities. Find someone else in your community who is also a parent of this type of a child. What did they do? What was helpful? So it really does come down to proper education and information. I think that's a really big deal. I also think it's a really big deal to really know, like, what is the best possible outcome? Like, what do you as mom and dad think the best outcome would be, right? And how can you get it? So, like, my son needed speech therapy, a lot of it. So, part of it I was able to access through the public school, but the public school did fail me with being able to give him completely what he needed. And so I supplemented that by paying for it privately. And I'm thankful that I was able to do that and I had the resources to do that because a lot of people don't. And if you don't have the resources to do it, how can you get that? What can you do? Is there a religious community who can help you pay for something like that for a child? But like what, or is there a nonprofit that you can get a grant for? But what does your child need and how can you access it? So for a lot of our parents, it requires creativity. And it goes back to you really feeling like just because someone's telling you no doesn't mean that that's the answer. Or just because someone's telling you they're not going to give you what your child needs, that doesn't mean it's the answer. It just means you have to be able to figure out what the answer is and do the very best that you can to provide it. At the end of the day, there's no job in the world that's more important than being a parent.
Exactly. Now back to your book. I have your beautiful book here on my phone. Maybe you should educate me. I'm saying tumbleweeds. Why the use of tumbleweeds? Why did you choose? Why is tumbleweeds the words of choice? Let me put it
That
that
is that is an excellent question. So, after I had my first child, I had trouble. Well, I thought I was having trouble getting pregnant with my second child. It took me a really long time to get pregnant with my first child. Like we had been trying for a long time, but we did not have him until I was 33. And so, things with my body were not quite right. And I went to the doctor and they told me that I had a low of I had essentially I was in premature menopause. I had a low ovarian reserve for my age. So they said that I actually had a 0.018% chance of being able to get pregnant again. And that I had so few eggs that they were not able to actually harvest my eggs. So I couldn't do IVF if I wanted to do it. I wasn't a
out.
candidate for IVF. And
Oh,
so I wound up getting pregnant naturally with baby number two, well, and baby number three, which is I still find insane. But I got pregnant with baby number two naturally. And I was laying in the hospital. I was laying in the gynecologist's office with my husband, and we were watching him on the sonogram. And my doctor looked at him and she said, I have no idea how you guys got pregnant with this baby because the odds were completely against you. Like this child was literally like a tumbleweed rolling through the barren desert of your fertility, which sounds awful, but it was also true. And so in any event, we had Pearson. He was our little tumbleweed, and we called him Tumbleweed while I was pregnant with him up until he was actually born. And when he was born, he was so little that my father started calling him Squirrel because he was the size of a squirrel. And so he really kind of goes, we call him Squirrel even to this day, but Tumbleweeds was what the doctor referred to my second child as. And then of course I somehow still got pregnant with a third child, which we don't and also for the record, I had that test for my ovarian reserve over and over and over again. And it was really low and really bad. And again, this goes back to like, why does storytelling matter? I know that in some cultures of the world, women are not able to talk about their physical health the way that they would like to. And even in America, talking about women's physical health is still very stigmatized, and we're not always free to say the things that we want to say. But I just want to tell women that, we need to be able to have these conversations amongst ourselves because you never know
exactly.
when you're going to learn something that you need to know to bring you peace or to help you accomplish a long-term goal like having a
Exactly.
baby.
Exactly. Thank you so much. I was smiling all through and even happy tears. Thank you for sharing your beautiful story with us. The first question I asked you was about the filling system. And you gave a very elaborate and educative answer to that. Now, it comes back to the last question I have for you, Paula. Back to the filling system. You've given birth, you have three beautiful children now. There are people getting married every day, and they are going to give birth. People are giving birth at this moment. What do you see in the next 10 years, in the next decade? What do you see the health system in US? What do you see its outlook to be in terms of management of children, especially those with special needs?
Oh, goodness. I will be honest, I am very worried about the medical system in the United States. Cost of healthcare overall is just getting really out of control. It's very difficult for people to be able to access health insurance. Health insurance is very expensive. Lower income community members are having their health insurance benefits through Medicaid cut. Um, I'm actually, I mean, I don't want to be doom and gloom, but I do feel very bleak about it. Like, I do not feel that we are providing the resources that we need to help, anyone at this point. And I'm very worried about that for special needs children who do need things like OT, PT, speech therapy. I think in many cases, those services are going to become cost prohibitive. Their parents are not going to be able to get it or because the insurance company just won't work with them. Like American health insurance is probably the greatest hindrance to American health care.
Thank you so much for that. Thank you so much for that. I don't think I have anything to add to it. You've given us an exceptional overview of your book. I believe anyone who didn't know of your book, now they know of your book. Anyone who was not interested in reading your book, now they want to read your book. So thank you so much for writing your book. Thank you so much for sharing your story with us. And thank you so much for inspiring parents, mothers, and women across the globe. So thank you so much, global citizens, for joining us on this episode of Fajembola'S Opinion. We've gone through Paula Yost's book on how to take care of your children and how she shared story with us on Tumbleweeds. So when you buy a book and you see Tumbleweeds, don't be shocked. I don't start looking or Googling it. What is it? Did she eat it when she was pregnant? Was she gifted when she was pregnant? So that is why you should also watch this video. So thank you so much for that. And I hope you enjoy reading the book as much as she enjoyed sharing her story with us. Have a blessed week, everyone.